Do you experience body symptoms and sensations when you're anxious or stressed that start to really concern you and worry you? It might be something uncomfortable like nausea or breathing problems, or even really concerning like heart palpitations and skipped beats. So this is an area that I get so many questions about from my clients with anxiety, panic, and health anxiety. So today I invited a physician, Dr. John Pradko, who also happens to be my partner in life and husband. I'm going to ask him to explain a little bit more about body mechanics in detail, like what is actually happening in our body when we are experiencing anxiety, stress, and panic. Hi, I'm Paige Pradko, a practicing psychotherapist that specializes in treating people with anxiety disorders, health anxiety, and OCD. Welcome to Therapy for a Better Life. But before we dive right into body mechanics and why we feel different symptoms when we're anxious, I want you to know that I left you a gift. If you go to the description of this video, you'll find a free PDF, and it's called Why Do I Feel That in My Body? Explanations of Bodily Symptoms Due to Anxiety, Stress, and Panic. It's really an informative PDF. I know you're going to be glad to have it, and I hope it helps you. Today I have a special guest, Dr. John Pradko. John is a family physician, and he's been practicing for over 30 years. And he's also a medical student trainer and a resident trainer. John, how would you describe what you do?
Well, as a kid, I always loved repairing things. And now as an adult, I like to call myself a repairer of man. I enjoy the challenges, and I also enjoy the personal interaction with the people I treat.
Yeah, I think you have wonderful relationships with your patients, and I know from being in his office that he has generations of families.
Yes, we do.
That continue to work with John. Today we're going to talk about kind of the body mechanics of what happens during fight or flight. What happens in the body when we're in a state of anxiety or panic. Sure. I think that when people understand what's happening in the body, their anxiety comes down a little bit.
That's certainly true.
If they worry about it and they don't understand it, the anxiety, of course, can go up. So we don't want that.
That's right.
But let's talk about some of these symptoms. The first symptom would be this difficulty breathing. Kind of people describe it as this difficulty getting air in or getting on top of a breath. What's happening there in the body?
A lot of people refer to it as air hunger, a feeling of inability to get enough air in. But in reality, through the anxiety response in the body, the person's actually breathing heavier. They're pulling in more oxygen, sitting there full of anxiety, and they're actually getting rid of too much carbon dioxide. There's not an issue with oxygen. It's the blowing off of carbon dioxide, which changes our brain chemistry and actually contributes to our anxious feelings.
What's interesting is from an anxiety standpoint, because there's too much oxygen and not enough carbon dioxide, what we can do to help that condition is actually hold our breath.
That's right.
Really slow our breath down and hold it, or really long exhales.
The body will autocorrect if we're left to our own vices, but there's certainly psychological techniques that can speed that recovery.
Yeah, that's a really good point, that we really don't have to do anything.
That's right.
The body will autocorrect. Another symptom that sounds kind of strange is people will describe having a lump in their throat. Like
yes.
They really feel like they have this big lump, and almost like it's almost smothering or choking them. What's happening there?
Well, in the literature, you'd refer to it as a Globus sensation. As a physician, we don't just jump to those thoughts. We have to, like everything we'll talk about, do a complete workup. Other medical conditions can certainly cause that, but having ruled those out, that Globus sensation is a contraction of the muscles brought on by the stress that we didn't intend our body to do to us, and that feeling gives us that full feeling or that foreign object feeling.
Oh, that's interesting. And that just resolves on its own as well.
That's right. Most all these do. This is a muscle tension due to that anxiety.
And not really a danger.
Not at all.
Not at all. One symptom that I think really alarms people are any sensation involving the heart.
That's right.
And whether it's a palpitation or a racing heart or skipped beats, chest pain, pressure, people get very, very anxious. And of course, anxiety can create all of that, as well as other things.
That's right.
So tell me a little bit about what you do when someone comes in with that complaint.
Well, by far, cardiac symptoms are, in my experience, the most common. And on an approach from a physician point of view, we look at the complaints, we listen carefully, and then appropriate testing allows us to rule out if it's an electrical or a physical problem. But having ruled out the medical component to it, we're still not done, because the body is producing excessive amounts of adrenaline by stimulating the adrenal gland. And this is what can bring on the feeling of palpitations, the chest pain, the tightness in the chest, and all of those cardiac symptoms are very real, but they're not dangerous.
That's interesting. What just out of curiosity, what kind of tests might be included in a cardiac workup?
Depending on the health and other conditions in the human, the patient we see, it could be a stress test, it could be certainly just an EKG, blood work, might be a monitor to a doctor would put on you to look at your heart over 24 hours or even up to 2 weeks to see if there are actual physical changes going on.
Yeah, that's important. When I see a client with kind of chest palpitations or any kind of cardiac complaint, I like them to have a workup first, because how we treat that in session, among other methods, is we might do interoceptive exposures. We might actually try to get their heart to race and get their heart to have palpitations by doing physical activities right in session.
That's right.
And so I do like them to have this workup and kind of an all clear before
right.
we go into that exposure experience.
That's right.
So some other symptoms that I hear often are nausea, and or gastrointestinal problems like diarrhea and maybe pain, intestinal pain. What's happening there during anxiety?
Well, often the fight or flight situation, if you could picture back to our ancestors, was running away from a danger. And if you were in the middle of a meal or you were sleeping, you have no purpose to have your digestive tract operating. And so a person will shut down their intestinal tract. That can lead to anything from reflux to nausea to vomiting to uncontrolled loss of our stool function, even urination out of control. And these are extremely disturbing in modern society.
Yeah, and I think many people that maybe when they're doing public speaking, they get a dry mouth. That's all
right.
part of that too.
Yes.
It's like the digestive system stops, right?
That's
because there's no need for it. We're in survival mode right now.
Right.
At least our brain thinks we are.
Our brain thinks that.
Yeah. Another symptom that I hear a lot about is dizziness, kind of this lightheadedness, and that can actually transfer into a fear of fainting. Can you talk about that symptom a little bit?
Sure. The probably least possible thing you would do is faint. But when we have this adrenaline response and the heart rate's going up, the rapid change in the chemistry of our body, our heart rate, even our emotion triggers sometimes a lightheaded feeling. And it gives us the immediate thought, oh, we must be getting ready to pass out, when in reality, we're stored with all the necessary tools to do just the opposite. That's right.
And it is kind of interesting because it is the opposite of fainting. When we're in
That's right.
fight or flight, it's survival mode, and your brain is working so hard to help you escape from danger the last thing your body is going to do is make you faint.
That's right.
And so we can, we can get all of that dizziness and stuff just from that change,
Correct.
that rapid change of what's going on in our body, preparing us. Thank you so much for just explaining
Sure.
all of that a little bit further. And like I said, when you understand the body mechanics behind like what is actually going on during fight or flight, it really does lower the worry and lower the anxiety. Like, oh, this is just what my body does. And for whatever reason, my brain got the idea I was in danger. If you would like more information on what is happening in your body, the body mechanics during anxiety and panic and stress, I left a free PDF for you, a link below in the description of this video. And if you are interested in more help for treatment or any question, please go to paigepradko.com and leave me a message there. And until next time, I will see you in session. Take care.
Goodbye.
Bye-bye.